to just shout out. I wanted to shout out Lori Graff, who just introduced herself, our school health professional, for helping organize this and taking the lead in her ongoing efforts here at Northfield, both with this and other programs. And now I'm going to turn it over to Shelly and Nicole, who are the experts on this topic and will help us through it all.
Great. Nicole?
Okay, awesome. Well, hello, everyone. Welcome, welcome. So glad of you all to be here and to join us today. My name is Nicole Augustine. I'm an advanced implementation specialist with the Opioid Response Network. My background is in public health and prevention. I like to call it the behavioral health cousins. So I'm on the prevention side of things. I'm sure you're familiar with harm reduction, treatment, and recovery. So it's a pleasure to be here today. And I'd like to introduce my colleague, Shelly, who's with us also.
Yes, so my name is Shelly Manlev, and I'm also a prevention consultant with the Opioid Response Network. I spent 20 years as the prevention coordinator with the Santa Fe Public Schools here in Santa Fe, New Mexico, as both a community coalition leader and working with the schools and the youth. And am deeply concerned, as I know all of us are, about this growing threat to our youth, and hoping that together we can learn more, share more, and do what we can to protect our youth and help them and help all of us have a healthy future. So thank you for introducing yourselves in the chat. We're a small group, and it's really great to be able to be together. Shall I start sharing the screen?
Yeah, go right ahead.
Great.
Great, awesome. Thank you, Shelly. So we've introduced ourselves. We have just a few slides that we have to share. So one, you can know who funds this. It is required for our grant. So hopefully everyone has heard of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They are who fund the Opioid Response Network. And so our work is national across the country. And essentially the network was created to provide individuals, communities, schools with any sort of training and technical assistance related to the opioid crisis. Now, our mission now includes stimulant use also, because we've been seeing those two crises kind of follow each other. So we have expanded our work to include stimulant use, but most of our work is in the opioid response space. Just so you all know, if you've never submitted a request, we're here because Lori has been through this process. She submitted a TA request, which is extremely easy to do. The easiest way to do it is to connect through our website. And what ends up happening is you're connected with a local TTS, as we call them, which is a technology transfer specialist. And those folks will get you set up with someone. In this case, it's Shelly and I who are here to talk with you all. But depending on your needs, it could be any number of consultants across the region. So we are here, happy to be of help and assistance to you all in your work as you continue to explore this and move forward. So it's a very easy process. Now, there is something Shelly actually mentioned when we were just starting here, that just acknowledging the desire to learn from everyone. And that's really what we want to make sure everyone understands. We are here as facilitators of a conversation to create an environment of learning and reflection, of thinking about this crisis. We're going to share data, information, a lot of information together today. But really, I don't want you to look at us as experts telling you all what to do, but really creating a space to facilitate ongoing learning and conversation as we are all navigating what's happening across our country as we respond to the opioid crisis. So we're really excited about our conversation today. We have a few learning objectives that we're looking at. We're hoping that by the time you're done with our time together, that you'll have a good sense of what the trends are looking like, that you'll understand why we focus on person-centered language versus stigmatizing language. And then we'll spend some time talking about what is fentanyl, what are the fentanyl-laced substances, what are some of the 2 ways we can prevent a deadly overdose? And then we want to end with making sure that everyone has access to resources from the school and from the community level so that we can be of support to youth and families that are dealing with substance use issues. So we've got a tall order in front of us. I think we'll get it all accomplished in our time together. And as we said earlier, we're so excited to have been invited here and to be a part of this work with you all. So let's get started. We thought that it was important, and I mentioned the behavioral health cousins when I gave my introduction, but we thought it was important to set a context for everyone to understand that there is a continuum of care when we think about this work. And mostly, ideally, a lot of the work that you do in the school system is really focused in the prevention spaces and thinking about strategies that prevent use from ever happening, right? That's our ultimate goal, especially when we're talking about our youth here. I think it's also important that you all know that there are other parts of the spectrum, one being harm reduction, and we're going to talk a bit about the types of harm reduction strategies, which typically focus primarily on reducing harm and reducing overdose. And then, of course, we want to make sure folks understand that there are some instances where folks need treatment and long-term recovery. So we'll touch a little bit about what are those resources locally for you all to be referring students, whether in the school or in the community, who are needing higher levels of care. But we thought it was a good context that you all understand the whole continuum. And even if most of your work is focused in prevention, it's really good to know what are the other spaces, because when someone is identified at higher risk, we want to make sure they get the right type of care and to get that early. The other main precursor to our conversation today is this idea around person-centered language and why stigma is such a big deal. Many of you may be familiar with the US Surgeon General, and I want to just highlight his quote here on the slide, which says that the biggest killer out there is stigma. Stigma keeps people in the shadows. Stigma keeps people from coming forward and asking for help. And stigma keeps families from admitting that there's a problem. And this is a really critical thing for us to be thinking about, because truly the stigma that surrounds this work, I think, prevents us from having constructive conversations that help us create prevention strategies, that help us respond. And so a part of this is, sure, we can talk about the resources and what you all can do, but if we don't really address the elephant in the room, which is stigma, it makes it really challenging to do this work. There was a World Health Organization study of the 18 most stigmatized social problems. And in 14 countries, it found that drug addiction was ranked number 1, alcohol addiction was ranked number 4. And so there's a lot of stigma around this work. If anything, I would say the stigma sometimes keeps us from responding, us from having the right type of resources in our schools and our communities. And when things happen, it keeps us from being able to really talk about what the situation is so that things can move forward. So I want to share just a short video with you all on stigma. It's from a group called Shatterproof. And I think it does a really good job of identifying one simple strategy we can do, which is focusing on our language and the words we use when we're describing this work.
Words can become grenades, strategically spoken at times to do the most damage. And when those words come from family and friends, they cut deeper. Labels erased my humanity. Total strangers felt allowed to criticize or judge me, saying that I was just a drunk or addict. These words also carried the connotation that I was lazy, selfish, or criminal. After a while, I began to believe the words, concluding I no longer served a purpose or deserved hope. Luckily for me, these feelings were eventually replaced with words that provided healing.
The research is clear. Not only do words shape how we view people, but words also shape how we treat them. For example, studies show that when someone is described as an abuser or addict, the general public and even clinicians are more likely to believe that they should receive punishment over treatment. Tragically, for those with addiction who are looking to lead fulfilling lives, hearing the terms drug abuse or addict is paralyzing and demotivating. It blames people for their own illness, ignoring environmental and genetic factors. It feeds into the stigma they experience from society, their family, and treatment providers. To help decrease stigma around language, the Office of National Drug Control Policy recommends using person-first language to replace judgmental and negative terms. For example, a person with a chronic medical illness that impacts their brain is not an abuser or an addict. They are John with a substance use disorder. John, a person who requires treatment and support to recover from his illness. Words matter. They can hurt and reduce someone's motivation.
Together, let's choose supportive, non-judgmental words that lead to treating people with respect and compassion.
Okay. So thank you for playing that video. It's really, really powerful to think about how words can do so much. I'd be curious, just for us in the room here, I'm just curious, how do you all feel you're doing on person-centered language when you're talking about substance use disorders? What do you all think? Oh, I hear something.
Security.
Yeah, I can go. So Leah, Megan, and I represent the DPS Prevention Services team, and we have a program in TPS called Teen Intervene. So, and Lori is the contact there at Northfield that teaches that program. So for us, it's so important to rip off any labels and to really, just help everyone embrace that, the student is struggling, and let's not punish or suspend, but really get around how do we provide supportive intervention. So the whole program is about, meeting with the child, the kid for several times, and then bringing in the parent. And so I loved that video. I think it's so important. And so thanks for sharing that.
Yeah, thank you. I appreciate your feedback. Anyone else? Are you guys feeling you're doing a good job on the person-centered language versus stigmatizing language?
Or just to add to that, I know it's something I have to consciously retrain myself. I mean, I certainly grew up with a habit of words, and even I'm going to say in the district that I worked in, how we were trained, right? It's not because
Okay.
Oh, sorry. There we go. I was going to say Amy was unmuted.
Thank you. We're glad you're here with us, Ms. Brigdahl. If there's something you're looking for, how you might say something differently. I'd also, if you have a question, it would be a great opportunity to ask.
Yeah.
Yeah, I will.
Oh,
Sorry.
Yes, please go ahead.
No, I was. Shelly took a lot of the words out of my mouth, and yeah, I appreciate that kind of vulnerability. But same. Just sometimes that's, growing up, the person-first language wasn't always what we learned. So it is definitely having to sometimes consciously reframe the words I'm using. And it's a really good, important reminder. So I very much appreciate that video.
Yeah, well, great. It's definitely one of our first steps, because the stigma is so big that it keeps so many people from getting the care and attention that they need early, which is what is needed for recovery, truly. So
just to add one thing, I think often our youth refer to themselves with stigmatizing language. I'm a druggie, right? Not I'm somebody who's used drugs, or or refer to each other that way. And I think, that can be confusing. They're talking about their friends, right? He's a stoner, whatever it is. There's lots of different language. And so, again, for us, it doesn't mean necessarily correcting what someone says, but it's what we do. And really encouraging you all, just really different to say someone who uses drugs than it is to say a drug, right? I think partly that's part of those 12-step programs. I have a dear one right now who says I'm an alcoholic. I'm not about to correct him around that. However, I say he's got an alcohol use disorder.
Mhm. Mhm. Those are great points, Shelly. Appreciate that. Great. Okay. Well, I encourage you all to think more about this, especially if you all consider doing any sort of communications around this topic, that as you build those, really be thinking about the language you're putting in black and white, because it can definitely set the stage and the tone for future conversations. All right. So I think we're going to talk a little bit about fentanyl now. Great. We had a couple.
We got some questions.
Yeah, we have a couple questions. I don't know. Did you want to do this through Menti or just have people say here?
Which are
We
people
can just
explore experimenting with Mentimeter, or do you want to? What would you like?
Yeah, if we do it on Mentimeter, we'll just I'll have to share the screen. Which I can, there we go. Perfect. Okay, so I'll just share it with you all. It's just a cool way to interact here. So I'm going to show you, all you have to do is grab your phone if you don't already have it near you. And there's two ways you can do this. You can pull up the camera and you just show the QR code to the camera and it'll drop you into the Mentimeter here. And then you just vote. Or you can go to a website, menti.com. You'll put in this code here and that works too. So there's two ways to do this. And you only have to do this once. We have a couple Menti questions. It's just an interactive way of gathering information from you all to participate without having to use your voice in a different way. Okay, so great. We got votes in already. So how familiar? All right, so we got a mix here, very familiar to somewhat. Wonderful, just people right in the mix, so this is great. And then we have a follow-up question, because this is about really thinking about our familiarity and then our comfort. How comfortable do you feel talking about substance use with either your child or children?
Thank you all for participating. It's great.
Yeah, this is great. And these numbers don't surprise me. We have a tendency to have the choir in the room at presentations like this. I'm always like, where are the other folks, so I'm actually really happy to hear that folks are already having conversations and that some folks are saying, you know what, I'm somewhat comfortable. So our hope, and I'll stop sharing here, Shelly, our hope is that in our time together, we can give you a little bit more information to help increase that comfort around having these conversations.
Absolutely. Thank you. So just a little time that I'm going to spend talking about fentanyl again. I'm going to invite everyone to add in your knowledge. We have a lot of you who are very familiar. So it's been interesting. I'll just say for me, this reminds me of where we were in terms of e-cigarettes, I want to say 7 years ago. Our young people were being captured and, in that case, addicted to nicotine in many cases by e-cigarettes. And those of us who were working with youth, parents, who had young people, weren't as aware this was going on. And today, unfortunately, with fentanyl, it's about life and death. And fentanyl is now the #1 cause of deaths for Americans 18 to 45. We are in a new wave of the opioid crisis, and it began picking up around 2015 slowly, and this is just hugely taking off. In Colorado specifically, and I will say, much of this information isn't from sources that I would have normally gone to, the CDC. I mean, that particular, the #1 cause of death is from the CDC, but from our statistical sources, the Colorado Department of Public Health and the Environment, the source of statistics, they are very cautious in sharing statistics. A lot of this information is available because the media is doing investigative reporting. And why are they doing that? Because almost every day now in the Denver Post, I've been monitoring your newspaper, there's an article on fentanyl. Some of that's because there's legislative considerations around strengthening, really increasing the penalties for the people who are distributing and dealing, but it's not, because our nation as a whole is focusing its attention. And these deaths, all overdose deaths matter, but they're now occurring with younger and younger children. 13-year-old middle school students, you'll see in the newspaper, whether it's in Connecticut, Oregon, or Colorado, 15-year-olds, it's happening much more frequently. And in fact, in Colorado, in 2021, there were over, that's just the end of last year, over 800 deaths from fentanyl in Colorado. That's 3 per day, right? That's a lot of deaths from something which we hope can be preventable. And in particular, again, it used to be the median age was in the 40s or 50s of someone who died of an overdose. Typically it would be somebody who had an opioid use disorder, went to jail, got, had forced abstinence, right? Weren't able to use their opioids, got out. They had lost their tolerance. They used the same amount they used to use, and all of a sudden they were dead. That's changed. Fentanyl's changed everything in terms of overdose deaths. So you can see the number of overdoses involving fentanyl nearly doubled from 2019 to 2020 with this, it was 250, then 500, now it's over 800 in 2021. And what's being tentatively reported is there's already in the Denver area been 200 deaths from fentanyl in the first 3 months of this year. So in terms of youth, tripled over the last 2 years, that's from 2020 to 2021. And in particular for our young Black males, a 5-fold increase. So it doesn't affect every group the same, but it's an extremely serious public health crisis. I'm not into comparative drugs. I'm not into comparative diseases. Obviously, COVID is extremely serious. There are many things. Suicide and overdose death is actually a greater cause of death amongst our youth than guns, a greater cost of death amongst our youth than suicide, other things that are obviously deeply troubling to us. So this is just a picture of that graph to bring home fentanyl deaths in Colorado. This is where you live. That number over 800 is preliminary data still, but it's the trend is clear. The changes are small, as I have tracked over the last month and a half. So actually, before I just go into fentanyl, any questions about those stats? Any surprises? Is that reflecting what you're hearing? Yeah.
Shelly, I was just going to comment that when you show the numbers as a bar graph, it's so striking. Like I can see the numbers as numbers on the previous slide, but when they're visible like this, it's just like, oh my gosh, the reality of what's happening is just, it's a lot.
It's a lot. And again, we don't yet have the data by age, but we do know that the majority of these are between the ages of 18 to 45. And it includes, as you've read, I was considering dedicating, we just had during spring break in March in Lakewood, Colorado, just, a 16-year-old who died from a fentanyl overdose. Of course, the young adults in Commerce City, that was related to a fentanyl overdose where they thought they were taking cocaine. Some of you may have seen, and I have a resource list, which I'm happy to share. ABC Nightline at the beginning of April, just 3 weeks ago, did a piece, a girl who survived, a teenage girl from Boulder Valley School District who survived, and she and her family went on ABC Nightline nationally to share, to try and inform people. So all of us are going to become ambassadors for health. And again, many of you already are. So what is fentanyl? It's a synthetic opioid. It's not plant-based, right? It's made. It's tasteless, odorless, and extremely potent. 50% stronger than heroin, 100 times stronger than morphine. It can be used safely to control pain when it's prescribed by a medical provider and used as directed. So in cases, some of you may know people who've had surgery. Recently, a friend of mine had a kidney stone. Anyone knows how phenomenally painful that is. Fentanyl, another friend of mine just went in with a blockage. Fentanyl's incredibly potent painkiller. It is not a Schedule I drug. It has a medical use, right? But that medical use requires incredible care in how it's administered. And I find this hard, not showing a picture of this, but a small, tiny amount of fentanyl, 2 salt-sized grains can be deadly. Often you'll see pictures on a penny. They'll show you just what covers the hair on Lincoln's head on a penny. Not that any of us has seen pennies in the last 2 years, because I know I haven't touched change, but still, we are talking really, I mean, a very small amount. And it's important to know that every pill starts as a powder. So it's, first of all, it's super cheap to make. You know, there's questions, and you may have questions, and I've done a lot of studying. I'm happy to answer about where does it come from, but it's cheap to make. Generally, the census it comes from, it's produced, manufactured in China, comes to Mexico, and often it's just the fentanyl that's then, you know, ground up, mixed with other powdered substances, just a filler, it doesn't matter. And then it's added, or in some cases, it's the only active ingredient to increase the drug distributor's profit. And just like we're having all kinds of supply chain issues, getting things in the grocery store, there's also supply chain issues getting pure drugs. And it can be mixed with cocaine, it can be mixed with heroin, it can be mixed with oxy, Percocet, benzos, Xanax, depressants, Adderall, stimulants, and it is. So part of what makes it so difficult, remember, it's odorless, tasteless, mixed in, and so you cannot visibly tell, you cannot smell something to tell if a substance contains fentanyl. And there's no way to be certain that it's evenly distributed into a dose. So if you have a batch of pills, a bag of powder, you have no idea what part of it contains fentanyl. So any pill line bump hit could be the one that causes an overdose, even if another one doesn't. So just to pause for a moment, any questions people have about what this is? I mean, it's kind of, you know, again, this tiny amount of a substance being mixed into a liquid or from a powder or into, again, any powder or pill. So it's not just opioids that you have to be concerned about.
I was just going to add, Shelly, I agree. We're hearing that too, even cannabis, you know, that fentanyl is being mixed in with. And thinking about like harm reduction measures and fentanyl testing strips, and do you have any like information about like the sort of efficacy of those items?
Okay, you're taking me into the next slide.
Like, we did not pay her to be here today.
So I've actually, you know, these are questions that the field of harm reduction, as Nicole mentioned, is the approach that a very important approach that involves reducing the risks, helping deal with some of the problems related to substance use. We know that some people are going to use substances, some teens are going to. Not the majority, you know, there's a whole group in Colorado called Rise Above Colorado. The majority of youth are not using substances. Still, you have about a quarter of your youth in the Denver area, according to the Colorado Healthy Kids Survey, who said that they have sometime in their lifetime taken a prescription pill that didn't, you know, wasn't theirs, wasn't prescribed to them by a doctor. So whether it's a quarter, fewer, more, it is a group of teens who are and have been taking prescription pills. Of course, cocaine, you add that, other ways in which they can come into contact with fentanyl. So there are harm reduction measures to address overdose. Obviously, we're going to talk about talking to teens. We hope that nobody takes pills or powders that are not pharmaceutical grade ever. That's where we are in 2022. You know, it's life risking. You can risk your life. But we do want to be prepared in case somebody does, because those powders and pills are out there. The Drug Enforcement Administration is saying that in some areas, it can be up to 3/4 of the powders and pills. Again, non-pharmaceutical grade powders and pills that have some fentanyl in them. And given the tiny amount of fentanyl that's in there, sometimes I think it's amazing we aren't seeing more than the amount of overdoses that we're seeing. It has penetrated And while Colorado is not alone, Colorado is definitely one of the places. Oregon, sometimes it's hard to know whether because there's more news attention. California just recently, about a week ago, another reported, right? These are the ones the families are reporting to the news media and are saying, we want people to know because we want to protect the next student. So in response to your question, Haley, naloxone is effective. I think I remember from discussions 4 or 5 years ago with police departments, there was real concern about even getting near someone who had an overdose. Was the fentanyl on my hands going to kill me, right? Was naloxone going to be powerful enough? I'm not saying 100% of the time that the naloxone is powerful enough, that people have enough, but the anecdotal reports is if you can reach somebody with naloxone immediately, again, fentanyl being so potent, the effect with something like an overdose on heroin, it can take 15, 30 minutes before a person stops breathing. Fentanyl, the effect's quicker if somebody, depending upon how they've taken it. But if a person near them has Narcan, it's the technical name is naloxone, but nasal Narcan is the easiest way to give this amazing opioid antidote. It saves lives. Some people call it the Lazarus drug. And because if anyone has talked to somebody who's used it with somebody, used it on somebody who's had an overdose, I mean, literally, they open their eyes. They're often not very happy because they've just, you've just taken, truly, I mean, better they be angry, but you do need this, you need to be prepared for that. But it immediately unlocks the opioid from the opioid receptors and they start to breathe again. So nasal Narcan is widely available in Colorado, no cost. City of Denver, you just have to fill out this form. And again, this PowerPoint will be available. The link, you can just Google City of Denver harm reduction services. Anyone in the city of Denver for free can have naloxone mailed to them. And it is. If it's a fentanyl overdose, people are reporting that it's effective. Sometimes you have to give more than 1 dose of Narcan. The kit comes with 2. And of course, before you give that dose of Narcan, this isn't a Narcan training, you want to have called the paramedics because you want a backup. You never want to be doing that without having the paramedics on their way, first responders on their way, who also have Narcan and many other medical tools. One of the things that I have to say I love about nasal Narcan or naloxone is if it isn't an opioid overdose, if somebody had a seizure or something else is going on, it doesn't harm. I could give myself nasal Narcan, it would have no harm. It's safer than any other over-the-counter drug. So there's no risk in giving it, and Colorado protects anyone who gives it to save lives. Does that answer your question? Yeah. I think there's a relief in the harm reduction and community and people who care about people who use drugs that Narcan has been as effective as it has with fentanyl overdoses. Again, nothing is 100%, but it seems to be. And then the other harm reduction tool that we have is fentanyl test strips. They are not perfect, as you can imagine with something like this, but they are cheap. You can also get them from the city of Denver. They're very inexpensive. And for people who, who regularly are using pills and powders, they are using this. They take the residue from a bag. It's almost like a pregnancy test strip, or, you mix it with very little liquid. There are training videos online. You can learn to use these. And I guess the test that I'm most familiar with now is all the COVID. I've done, that COVID rapid testing. It's very similar to that. You dip it in the liquid and you see if a line appears. I have to say, for people this is generally most acceptable to people who are regularly using something that could be contaminated with fentanyl. And again, more and more, you cannot trust anything, any supplier, any drug dealer. So.
Can I ask a question about that, Shelly? Sorry to interrupt.
No, please, I appreciate interrupting.
I had heard, and I know you had the caveat in there that they're not 100% effective, but I had heard that especially because it's such obviously some testings better than nothing if you're not going to abstain from using substances. But I'd heard because it's such a small dose of it, like especially in pill form, if you're testing it, there's a high chance that you might not actually get the fentanyl tested, if that makes sense.
Yeah, it totally makes sense. So, so first, I love that you're asking questions. And Megan, I'm right on. Have you gotten your order yet? I'm really excited that you placed that order.
Not yet. And Haley said, I think she ordered like 2 weeks ago, and it might be, Denver might be a little backlogged. So, but ordering it was really easy. So
It's easy. They have had a huge number of requests. But I really, if one of you would let me know when you get it, I'd love that. I'm not a Denver resident, so I can't do that. What I will say, so the issue of how do you test, I can actually share. One of my colleagues in Nevada did an extremely good training video. But just to say, there are ways. What people do is you don't just crush one pill and mix it with water, right? You take the residue from a batch, either the bag that has had the powder of cocaine in it, so that you are looking, it increases the chance that you'll be able to test more effectively. Again, they're not 100% at all. I think, I have to say, I think that they are worth, for people who are regularly engaged in using a substance, which is not generally what our teens who are at risk are doing. Our teens who are at risk generally because it's the first, second, 10th. I mean, they have, maybe they think they're getting a Xanax. That's what, the young woman from Boulder Valley School District, maybe they think they're taking an Oxy, but they're getting substances from social media, from the internet. It's phenomenally easy. Snapchat says that it's cracking down. We've gotten to the point that the Drug Enforcement Administration actually has a decoder for emojis for Snapchat. Again, that's on this resource list. I know, wow, I just saw Leah's lips. So, they say to encourage, that to encourage parents to become as knowledgeable as your young people are about the substances. It's difficult. But right now, our young people in terms of fentanyl are not that knowledgeable. And I think we all need to be engaging, including sharing the things we don't know, right? That's why is it not showing? There. We all need to be engaging in conversations, including conversations that we may, I appreciate that you all felt so, half of you felt so comfortable talking to teens. Even for those of us who've done this professionally, this fentanyl conversation can be challenging. The most important part of the conversation is that we have it. I want to say, if you have it, I'm curious, right? Have you heard anything about fentanyl and what's going on right now? What a great way to start a conversation. I just read in the morning paper, right? Or I just heard on the radio. Looking for those opportunities to start a conversation. I'm concerned. I just went to this community conversation, right? And they were saying pills and powders, anything that's not prescribed by a doctor and gotten from a pharmacy. That includes, I'm going to say, stimulants, study drugs, right? That's a pill. If it's not from a pharmacy, you cannot really know. But it's like, what are you hearing? What are your friends saying? Have you heard about anything in school? I know that Northfield High Schools, could be looking at possibly in some of their classes, there are school districts that are making sure that either in advisory, in science, English, and health, that our youth are getting this education, because fear tactics, don't necessarily work. This is facts. There's a website called Fake and Fatal if you want to learn more about that, so you can feel more comfortable. Song for Charlie, it's a parent whose son Charlie died. There are parents who are speaking about this. We thought about showing you some clips, but that conversation, which is, God, what I just heard, really, this is life or death. I care and I want you to be safe. What do you know, right? And then say, it's happening. there are some teens who are dying of fentanyl overdose. It's risky. Any pill or powder.
May 17th.
It's cheap. It's profitable, right? They don't care about your health, although they don't want to kill customers. And then you can talk about where to get Narcan. Through the city of Denver, it comes in the mail. They can get Narcan. There are young people who are around other young people are using. They don't have to talk about their own use with you, right? If you're concerned about any of your friends, your siblings, your cousins, you can learn how to use it. It's really simple. Anyone can go to a YouTube video and learn. You can also get training. We want our young people to be looking out for each other. You know, one of the most dangerous things about pills, powders, is taking it alone. And so knowing this, right, is if you're going to use something that you don't know what it is, right, please make sure you tell somebody, you're around somebody. If you don't feel comfortable telling me, if you're a parent, right, please be around one of your friends who you know has Narcan. I mean, it makes a difference, or you know somebody who can call for help. We're here to help you learn, survive, and thrive. So those conversations, anybody else want to add anything about conversations they've had with teens, with their own teens? What's helped you get started?
I could shout out Lori and actually the Northfield students. I came there and, we visit a lot of the different high schools. And I was helping Lori with the trauma group, and we just came up and it was really awesome. One of the students in the group was like, yeah, did you know fentanyl could be mixed into cannabis? And I was like, well, there's a lot of adults that don't even know that. So I think you all are doing a great job there at Northfield. So thank you so much for hosting this. And yeah, I think you're leading, the rest of our schools. We need to get this on the agenda and have people talking about it more. So thanks for your work on that there, Lori and team.
Haley, I was just going to add to that. I'm an elementary school principal, and I've got kids experimenting all kinds of ways with cannabis. I've been trying to find the same vape pen on campus now for I don't know how long. So, when you talk to them, I'm very open with them. And when we talk about, well, what was in the vape pen that you just smoked in the bathroom with your 9 friends? They don't know. And so I think that's what's terrifying to me as not only a parent, but as a school administrator. We've got babies 8 and 9, 10 years old starting to play with this stuff, and they don't know what's in it. Their families aren't talking to them about it. And, we have EpiPens on campus for kids, but we don't have Narcan on campus for kids. And it terrifies me that an 8-year-old could smoke something in a vape pen with cannabis and fentanyl. And, we have nothing to help them except wait for paramedics. So yeah. I guess that's a question I have, just like, and I'm sure that we don't have the answers in the room, but it's like, what are we doing on a district level to provide, if we're going to have EpiPens for the rare chance that a bee might sting a child and they might have a reaction, like we should have Narcan even in our elementary school. So that's why I came today, because I've got babies experimenting with things that at such a young age, and it's mind blowing to me.
Yes.
And
thank you for saying that.
So, yeah.
Oh, thank you for saying that, because I think about CPR, EpiPens. There's all these harm reduction strategies that are in our spaces that we have said yes to. And this is no different, because that time that it takes to wait for the paramedics is why we do CPR. Because there's something we can do in that immediate space to prolong, to save a life, really. So I'm so glad you mentioned that point about what is the conversation the school, the district is having around being prepared, which is what this is about.
And Leah, I can answer not give a definitive answer, but I know that nursing services is currently in talks with legal about having Narcan in every school. Frankly, they've been in talks with legal for quite some time. So it's something that I've been putting some pressure on. Our team has been putting some pressure on them. And it's a little frustrating too that they're so behind. Also, I would love to chat with you to talk more about some of the services that we can offer for elementary schools. So I'll reach out to you.
Yeah, that'd be great. I'd be happy to connect. And also, I think you know, even just pulling elementary data in terms of like, what are we seeing in terms of vaping's the big thing in elementary. So like, I mean, at least as far as I know, seems to move up to like edibles and things as they go through like, you know, middle school and such. But yeah, I would just be curious too, in terms of like, if legal and nursing are meeting, what are the stats for elementaries in terms of vaping or like vape offenses that we're seeing? Because that can also tell a story of, I mean, it's definitely been an increase since the, you know, coming out of the pandemic and stuff. So that would just be, I think it'd be a data source, but I'd love to connect on resources as well.
What I will say is that 2 school districts in Colorado already have Narcan in every building and people trained. There are resources to do that. The Colorado Consortium is available to support the district. And I think that if you all are interested potentially in having the Opioid Response Network work with the district to support this moving towards a policy, Boulder Valley School District did it in 1 month. The policy change is very simple. It is legal according to your law. You have all kinds of protections. It's explicit in the law that schools can have Narcan on campus and do that. And all the protocols are in place. So it is, I don't know what the barrier is, but if you do want support in that, you could ask the Opioid Response Network. I will just say that our district, Santa Fe Public Schools, again, with that, you know, when there's a decision, the policy change is very simple and it's pretty easy to implement. The training isn't very long and it's available for no charge. And again, through there's a bulk purchase arrangement. So yeah, it's awesome. They have fabulous, thank you. Nicole's putting links in the chat. So I think one of the things maybe out of this community conversation, I'd be curious, do other people want to see in school buildings that people are trained to address an overdose? Is that something that would be important to you? I see people. Yeah, anybody have concerns about that?
I just wanted to share, I don't have concerns about that. I think that would be smart planning. I have a freshman at Northfield. I have a junior at Denver School of the Arts. And I do talk to my kids about drug use and fentanyl. I'm an economist and I'm well aware of the economic incentives around fentanyl and how that's played out in just drug trade. One of the things, my son, you know, we have pretty open communication, although he does tell me that there's some things he wouldn't share with me, but he did share that, you know, he doesn't see a lot of vaping on campus, but he does, my son did share that, you know, people know who are selling drugs on campus, that's fairly widely known. And that, you know, that it's often these studying enhancing drugs. My son actually takes a non-narcotic treatment for ADHD, but he's very well aware of Adderall and its effects on non-ADHD versus ADHD. And we've had long conversations with him about, you know, the dangers of circulating that. But he, one of the conversations we did have recently and a couple people have raised is I had heard about the fact that what I'm more concerned about in his case is that he might, as he said, he's not interested in trying drugs, pills, but he sometimes is curious about pot. And I am curious about this issue of fentanyl in pot. I have read that that's a myth, that we really don't see that. And I don't want to, you know, kind of perpetuate that. So I was wondering if you could speak to that. And then also what schools can do to try, I mean, I think that awareness is probably the best course of action, but we know it's circulating not just in Northfield, but other campuses as well. But what students can do to sort of insulate themselves from those pressures and just exposure.
Let me answer your first question, then I'd love possibly for someone else to share more. So I've been speaking with Dr. Christopher Hoyt. He's the medical director of the Rocky Mountain Poison and Drug Center, and about marijuana. You know, there's a lot of, I want to say, rumors around marijuana and fentanyl. So there is not a documented incident yet of an overdose, death, or call that's specifically related to marijuana. It doesn't mean it's not theoretically possible. There is the great likelihood that the heating in a vape pen would actually just fentanyl. It's interesting to me that again, I think part of the reason I think you hear a little hesitation in my voice and speaking about it, I had hoped he would join us today, actually. And they are looking, they're doing an analysis. They're doing a lot of studying of this issue because they're really the poison control centers kind of getting a lot of the frontline calls, right? And they're also doing the analysis of substances that are brought into the emergency room when people come in with an overdose who survive. So I think marijuana is a very low risk for fentanyl. I'm not going to be willing to say zero, but extremely low. But the risk is powders and pills, and that includes ecstasy. That includes coke. I mean, it includes a lot of things. It includes, the ADHD drugs, Adderall, Ritalin. Again, that's what pharmacy grade, and that pharmacy pill carefully monitored, right? So I think we want to be careful that what we're seeing, and I have a bag in my study because I've done a lot of work with tobacco prevention education, collected from a K-8 school right before the pandemic, right, of what they had collected that year. And it was not 8th graders, predominantly 2nd graders. I mean, I feel for you. It's incredible, the collection of vaping devices, but also sometimes pills, right? And those pills are what we need to be talking about with fentanyl, the pills and the powders. I think when we start moving into marijuana and what's in vaping, we can say we can't know for sure, but that is not where the overdoses are being reported. Is that a helpful? I think when we start talking about marijuana being laced, we start moving into fear. It's not that it's not possible, but it's not where the overdoses are being documented and said, and where we need to be really focusing our attention on anything not pharmacy given. Yeah.
Shelly, what about, I asked in the chat box, what about edibles?
Edibles in terms of
so like marijuana edibles, are they able to be laced?
I don't want to answer incorrectly, except for, again, Dr. Hoyt, I don't know if you all know him, he's pretty amazing. They get, they are an amazing center, part of UC, did not describe, what he talked about was potentially being laced in the liquid, high level, that's used for vaping. And I have not heard or seen any references to edibles, and people's either anecdotal or otherwise. So again, from what the literature is currently saying, marijuana does not seem to be the source of fentanyl-related overdoses.
Can I ask one more question? I know my son also, both of my kids have ADD. And I know when my son was given medication for ADD, that's one of the things the pediatrician talked about, is that kids with undiagnosed or untreated ADD and ADHD are more likely to do street drugs in terms of Adderall and things like that, because they know their brain's going a mile a minute and they want something to, they self-medicate. They want something to calm it down. Is there information or training for families in terms of substance abuse prevention around these sort of like undiagnosed disorders and why kids could self-medicate? Like, is that a piece of it?
So I'll answer, then I'd also open it up if somebody else wants to answer. And that is that absolutely the young people who have ADHD, ADD, anxiety as well, depression, are at increased risk of substance use. It's one of the groups. It's not the only groups, right? We haven't been talking about, why do our young people use substances, right? Why are they drawn to take pills and things that, I'm going to say this, fentanyl is not the only risk associated with them. They obviously have positive effects and they have negative effects, and that self-medicating draw to feel better, particularly makes those young people more vulnerable. And I think, the beauty of the kinds of support that the prevention program at Denver Public School approaches is to address, how do we cope? How do we cope with, to destigmatize cognitive and mental challenges, right? And mental illness, and to really support students in different ways. For some students, high-risk group is thrill seekers, right? That's a group of, those young people I used to use a more stigmatized word, I'm going to say, to describe them, because I have a middle brother who's like that, who's struggled with addiction and substances, but who are drawn and need high levels of dopamine and thrill. And that's a subgroup who uses substances. There's a number of different kinds, but I think really, I think about elementary school, I think about parents, if your young person's struggling, right? If they're struggling because of attention challenges, if they're struggling because of mental health challenges, to seek. And that's really, this last piece is on resources, to seek resources. You are fortunate in the Denver area to have a lot of resources, both through school, but I do just want to say DPS prevention has a fabulous resource list. I would, hopefully it'll get posted on the Northfield High School website. You have at your school incredible, your prevention counselor, also known as your health services professional, or whatever, Lori, your title is, I'm sorry. School nurse, school counselor,
professional.
School health professional, thank you. And then in the Denver community, incredible resources. You do have a crisis line that can connect you. You have an amazing program for adolescents who are struggling with substance use and need treatment. It's called the STEP program. For those, it's free to people on Medicaid. They take lots of insurance, and for people who aren't insured, through school-based health centers, which while Northfield High does not have, other schools do, and a student can go to those school-based health centers. So the Denver area is fairly rich in resources, mental health resources, and others, of course, primary care, your pediatricians. So but I think those young people are at higher risk, and we need to be assessing that early and supporting them, right? Offering them strategies, coping strategies, building up their resilience, the magic word. Other thoughts that anyone else took, someone else, Leah, in terms of Haley, Lori?
No, we appreciate your partnership. This is a great resource. I'd love to get your email too, just so we can stay in touch. And
you have you have Nicole and my email on the PowerPoint. I'll share it with you. If anyone would like that, if you want to put I'll share the link to it. Actually, turns out PowerPoints don't share well, if you have too big of a file, but I'll put the link to it in the file if you want to put your email in. And of course, Lori has that. But Nicole, do you want to put your email in the chat, and I'll do that too?
Sure.
But a little, when you're asking about being offered and sold on campus, that is one of the places our youth, this was from the 2019 survey that was done. Here's my email. And again, it's, Robin, you were talking about support for students on campus, right? And I'm interested, maybe if somebody who's on one of your campuses.
I am so sorry. We're at the hour and I have another request I have to get to. I'm so sorry. Shelly, are you okay continuing to take conversation or any continued questions? I know.
Sure, I'm happy to stay on and do that.
Okay.
And thank you. Nicole and I have done a lot of work with this together, and I really, really appreciate all that you've done.
Thank you, Nicole.
Yeah, thank you all. So sorry. They're just back to back today.
Thank you so much.
A lot of other schools are doing these kind of conversations, some on site, some virtual. This is something we need to be giving much, much more attention to. I mean, I'm going to say if 200 people were dying of anything, I mean, that's in Denver so far this year. I'm curious what makes you, I'd be interested. I want to ask you the question, why do you think there isn't more attention to this issue of fentanyl overdose deaths?
Okay, some of it's around stigma. I think people don't want to talk about either why someone's like the reason someone's passed from something. I mean, I know of 2 fentanyl deaths in the last 6 months, and it's not being it's not being talked about, because there's stigma around the cause of death. So I think that's part of it. I think also it's, I mean, I'll say as a parent, like, it's just, you go to that place of like, just don't do anything, right? Like, don't try anything. It's all going to kill you. Right. And so I think it's also that fear of like, and then we do the old timers, like, drugs aren't the same as when I was younger. We just smoked pot, like, or whatever. Right. So it's not relatable in that way either. So I don't know. I think there's a couple different reasons for sure.
The stigma, definitely, it has, I'm going to actually put Song for Charlie I think it's .org. I should check and make sure. Some families have done just the opposite. They've, like, out of their grief, they have really decided that they're on a mission to educate. There's like 5 or 6 websites, different ones, but the Song for Charlie has a lot of information and videos that they've, that's a passion of theirs. But it is hard for families. It's like with suicide, they feel ashamed. They feel like it's their fault. I mean, all the things so that is why we started with Stigma. Oh my gosh. And I think it's why the question, I'm so grateful Robin asked the question about marijuana, because I think when we start going there, then we risk, again, God, comparative, young people will say, well, what's worse, alcohol or marijuana? Marijuana is better than alcohol, right? It kills fewer people. I mean, the comparative drug conversation. And there are lower risk, it is true. There are lower risk substances. And right now, wasn't true 10 years ago, but right now, taking a pill or powder is a high risk thing to do. And I think being able to make that discrimination and not start to paint everything, well, it could be, I think is important, because there are some of our young people are going to experiment. Some of them are going to do more than experiment. They're going to get, addicted and dependent on substances. And it is particularly dangerous right now for them to be doing that with pills and powders. Yeah, it's a sad conversation, I have to say. It's like, oh my God, the threat. And yeah, but we talk, or we give our kids, we teach them to drive, right? And we allow them to take these 3,000 and 4,000 pound vehicles that put themselves and others at risk. And of course, we talk about harm reduction. We do. I mean, and then part of that harm reduction is, please, no matter what you do, if you ever have alcohol, call me, we'll talk about it. And there won't be any immediate other than I'll come get you, or I'll come get you from your friends. I mean, those are the harm reduction kind of conversations we have. And I have to say with this one, if any of our young people do end up using a pill or powder, please don't do it alone. Please make sure whoever you're with, there's a lot of these adjustments that are being made, because if you use it alone, you're even at greater risk. No one's there to call 911. Yeah. Thank you, Robin. Thank you so much for being here. Yeah. Shall we all, if we can be supportive, Lori, thank you so much for organizing this, and Leah. Yeah. Any feedback? In terms of hosting, what you would like to see happen. Is this better done in person? Would you feel like, are you doing in-person parent gatherings at your school, Leah? Or are you still doing things virtually?
We are. I think we wanted to do virtual in hopes that we would get more people to be able to come.
Yeah.
I think that's a hard point, is just getting people's attention. I mean, Leah, Rafa, you sent this out to what, the 90,000 distribution DPS parent list? And, we had 13 people. So I think it's just, kind of somehow just getting people to pay attention to this issue and know that, it's important. We've tried to do parent. I just spoke to one of our folks that's at Lincoln and hosted a parent night. I think it was last week, and had 2 parents come related to substances. So yeah, I think it's just an ongoing challenge, finding the right time and the right, way to reach our parents. So
it goes back to the stigma thing too, because I'm just coming because I've got littles doing stuff that I'm like, whoa. And then, I've got a middle school kid who's a little more risk tolerant than his sister. And so I'm like, what, we're having some interesting conversations here. And there's some interesting things happening in middle school bathrooms around our district. So I'll just say that. But I think, I think if you knew, and I'm not asking parents to divulge their child's cause of death, or we have a parent in a elementary district school who died of a fentanyl overdose. It's not, public information, but it's like, if it comes closer to home, you're more likely to engage, right? When it's like, oh, this classmate passed, or this parent or whatever passed from a fentanyl overdose, I think people are more likely to like want to come get information. If there's a bunch of gang shootings in a school or a neighborhood, when the gang conversations come up, people flock to those conversations because they're like, what's happening in our community, right? And so I think part of it's just like people aren't talking about it, and that's people's right to not divulge that information about what happened. But I think that also keeps it so distant that it's like these other people that we don't know, and it couldn't possibly be happening in our school, and it is happening. So I don't know. That's just why I think people don't come. And I don't know how to fix that.
Did send it out to your entire email list. I just signed up for your email list, actually. And, I know that you host the Wednesday conversations that what do you get? 20, 25 people? Do you get that many?
It especially like end of last year, beginning of this year, I think at most we had over 100 people join, which is amazing. And we have seen a sharp drop off. For our webinar this Wednesday, we have a little under 40 people registered, and we usually get about half of that. I think there's a lot of different reasons, but right now is also a hard time with it being May, and even if you're not in a school, it's still
You're
a hard time. Yeah, so I think Lori and Northfield, the Northfield community championed by Lori, is doing such a good job of kind of trying to meet parents in all of the different avenues and students in all of the avenues, which is really cool. Leah, I'm excited to see you here because us in the prevention team, we are just constantly trying to reach out to elementary schools and even middle schools, and all we hear is, oh, it's not a problem here. To which we're like, great, we want to reach people before it's a problem. And so I think it's kind of almost to that stigma thing. If you have someone talking about drugs and alcohol, that it means that people are doing drugs and alcohol. So we don't want to talk about it because it makes people think that we're doing it, where we're just trying to give people, our students, tools to navigate through life, because life's hard.
Yeah, it's that same conversation of when we do like riding the waves and things, right? People are like, don't talk to my kid about suicide because then they're going to want to do it. It's like, that's not how this works. Or don't talk to my kids about sex ed because then they're going to want to have sex. And it's like, it's really not how this works, right? So, I mean, you have that percent of the population that like doesn't want the information. I do think, like, I just went on the substance abuse thing for DPS. I was shocked to see Merrill's like, and DSA is like the only middle schools, right? It's, I won't get into that on a recorded call, but I can say that like kids are doing things in bathrooms and